So we're going to start with about a month before surgery. We get all patients to stop any hormonal treatments that they're taking. That includes birth control and menopausal hormone replacement therapy. If you suffer from symptoms, bad severe symptoms, if you stop those medications, 2 weeks can be enough, but this needs to be discussed with the nurse or with me in your pre-op consultation. Approximately 1 month before your surgery, you're also going to have a pre-op visit at the clinic where we're going to draw your blood and do what's called an ECG or an electrocardiogram as necessary based on your age. If you're getting a breast surgery done and you're close to the age of 40, we're also going to require you to get a mammogram. And those are all the pre-surgical tests that you're going to need. Then 3 weeks before surgery, we get you to stop all of your supplements. So anything like biotin, collagen, omega, anything that is not a multivitamin, vitamin D, or calcium needs to be stopped because some of those natural products can have ingredients in them that can make you bleed more during the surgery. Those can be restarted after the surgery, about a week after the surgery. Same goes for your hormone replacement therapy, or your contraceptive pill can be restarted approximately 1 week after your surgery. Then 2 weeks before your surgery, we're going to make sure that we have the results of all your tests so that everything is good and we can go ahead and book your surgery. And then finally, 1 week before your surgery, we're going to get you to stop using anti-inflammatories or aspirin, anything that can also make your blood a little bit thinner. During this time in your pre-op, you will have a chance to ask all your questions related to the procedure directly with me or the nurse who's going to be going through the consent form with you. You will need to have somebody pick you up from surgery and bring you home, and they need to stay with you for 24 hours. It's also very important to note that for the first 24 hours after this kind of anesthetic, you cannot drive. Even if you're not taking the pain medication, you are going to be impaired and a little bit groggy for about 24 hours. For the day of surgery, what we like you to prepare is to make sure that you have your support person on standby, that you have gotten all of your medications ahead of time at your pharmacy, which we have already prescribed you, that you've picked up your compression socks, which are also going to be given to you by the pharmacist, and those are to help prevent blood clotting in your legs, that you wear loose-fitting clothes that are easy to put back on after the surgery. You must remove all jewelry, makeup, and nail polish so that we can properly monitor you and you're ready to go when you get here for surgery. When you get here for the surgery, come on a full bladder because we will get you to pee just to make sure for women that you're not pregnant, as that would be a reason to cancel your surgery. And then as well, making sure that we have the phone number of the person that is going to be picking you up from surgery that day. In terms of fasting, you need to be completely fasting for 8 hours before your surgery. That's no water, nothing else, no food. And if you have medications that you need to take, we will review them with you at your pre-op appointment for the morning of surgery. Most medications are okay to take with a tiny sip of water, but those will be reviewed with you during your pre-op appointment. The most important thing to have a stress-free experience is to really prepare all these things ahead of time as scheduled, and we provide you with a document that outlines all of these things that I just discussed.